Dr. Alika Lafontaine is an anesthesiologist with 20 years' experience in medicine. But for the next year, he's got a new job. President of the Canadian Medical Association, the largest national advocacy group for doctors. On a recent trip to BC, Dr. Lafontaine's colleagues at Royal Columbian Hospital in New Westminster made him feel right at home in the operating room. A far cry from his days in medical school, a time he says was so difficult, he almost walked away from his dream.
It was very intimidating for me coming into medical school without having any medical background on either side of my family. My mom's a first-generation immigrant. My dad comes from a small farming community in Saskatchewan. So ever since we were young, we didn't have a lot, but we always had big dreams. I sit here now as the head of an association that's been around for more than 155 years. You know, there's more than 92,000 physicians across this country. And we all share a belief that we can make a difference in people's lives. I think the scariest part of what's going on right now when it comes to physicians and providers is that they've lost hope.
Would you say Canada's healthcare system is collapsing?
I would absolutely say that it's collapsing. And for a lot of us, we hear about this collapse, but it doesn't affect us directly. And when you actually are in the health system where people are waiting, 10, 20 hours to get into an emergency room, or when someone puts an advertisement into a newspaper hoping that they can connect with a family doc, you can't help but acknowledge that we are at a very, very different place than we've ever been in healthcare.
Why is Canada's healthcare system collapsing?
The crisis was decades in the making, right? I think we often look to COVID as, the triggering event, but in reality, whether it was COVID or something else, there was a stress that was coming on the system. These decisions we've made over the years weaken the link between patients and providers. And I think if we rethink the way that we design care around that again, I think we have a lot of hope of making our way through this stress.
Many Canadians are experiencing that stress through a lack of access to doctors, long waits for treatment, and hospital closures. But doctors and nurses say their mental health is worse now than ever. More than half of healthcare professionals are experiencing severe burnout.
When you hear from people that, they're either scaling back the amount of clinical time that they're going to do, whether you're a physician or a nurse or other allied health provider, or they're thinking of leaving medicine entirely because of the stresses and burden of what they're experiencing day to day, you know that the need for that isn't just urgent, it's something that you have to do right now. One of the most amazing things for me to witness was how a generation of Canadians became armchair epidemiologists. And if we can include Canadians in this conversation where they start to understand health care in a way that they didn't before, I think we'll move that conversation in the direction it needs to go.
How do you think that approach could help?
There's two things that I think can help immediately. The first is breaking down those silos that we have provincially so we can actually start to share information, people, and resources in a much more collaborative and coordinated way. The second part is making sure that we move towards true team-based care. And so physicians have a role, nurses have a role, pharmacists and other members of the healthcare team have a role. And it's respecting that we're all trained differently and we all do different things well.
I want to ask you a question in the context of that 2020 report called In Plain Sight that talked about systemic racism in BC's healthcare system, but experts have said you could essentially apply the findings of that to every province and territory. How do you begin to tackle such an ingrained issue like that?
One of the insights that I've had over the past 20 years is that racialization isn't about the person sitting across from you, it's about yourself. It's about how you see the people that come into the places that you provide care and what you're willing to accept as far as lived experience and evidence. The experience of racism is real. I've experienced it myself. I have family members who've experienced it. Organizations like the Canadian Medical Association that have been around for 155 years, they're on their own path towards reconciliation. And there's a lot of positive things happening right now. We've never had more Indigenous physicians in this country than we've had now. And once we can acknowledge that things are real, we can then work towards those solutions that I think are in the hands of the people that experience them.
Undoubtedly, as the first Indigenous president of the Canadian Medical Association, you are a role model. Does that come with added pressure?
I've had the opportunity to stand on the shoulders of a lot of amazing people. And I have to be ready to have people stand on my shoulders. You know, I'm not going to be able to solve these problems by myself. And if you look at leadership as a process where it's not about your voice, but amplifying the voices of people who are actually creating change, that weight doesn't feel as heavy.
Contributing his voice to a group is something Dr. Lafontaine has experience with, and you may have even heard it before. He grew up singing and playing music with his siblings, performing in front of Canadian audiences as the Fifth Generation, a touring band. And that family bond is important to him.
I have an amazing wife as well as 4 amazing children. You know, my kids were so excited when they found out that I had been selected by Alberta physicians to become this year's CMA president. Medicine is a type of job where you give a lot, but you get a lot as well. Through everything, I still have that connection with my wife and my kids. You know, I come home, they're excited to see me, and they look at me and, you know, I really feel like they know that I see them. You know, and I'd say that if you're trying to change anything, like the thing that you should always be most proud of is that the people that you care about, they know how much you care.
I think I sense some emotion coming up as you talk about that. It must mean a lot to you to know that your family knows you see them. What piece of advice or wisdom would you want to make sure you instill in them?
It's this idea that when you connect with people, like, you can change the world. We often talk about systems and, you know, processes. I mean, we're a hyper operationalized society. I think the average Canadian sometimes looks at leadership in medicine as very disconnected with what they're going through. And it is true in a lot of ways that when you come into the system, you feel faceless. But at the end of the day, it really comes down to people and connecting with people. Because I think if you see each other clearly and you start to care about each other again, you can't help but change.